to go over instruments so you kind of understand them first, because instruments always scare people. I will put them back together. Okay, the sponge sticks. What the sponge sticks are used a lot of times in C-sections is, once you take the placenta out, you have those membranes and they're stuck. So these clamp atraumatically. They can clamp, I call it fishing, they all laugh at me. You can clamp the membranes and you can pull them and they separate easily right off the uterus. So those are what those are for, okay? Okay. Scissors are all a little crazy. So your Mayo scissors, which we use on our delivery table, you see them curved. They're for your tough things like muscle, your fascia, stuff like that. So your mets are your delicate ones. That's what they make a bladder flap with. Okay, so it's more tender stuff. Suture scissors, and these are just a utility straight scissor. Bandage scissors. These are really important, and when people are looking for them, you do cut the umbilical cords, like you clamp, cut in there. But your bandage scissors are like atraumatic. You see that little tip? So when they make an incision in the uterus, if they're trying to make sure they're going around the artery, they'll make a smile. They'll put their fingers in the uterus, trying not to break that bag of water, and this protects it and it won't cut. See how it's blunt? It won't break that water, and they can go up and protect, and then they'll do it other side. So that's what the bandage scissors are. Needle holders, it's kind of like they are. You see how heavy they are? The heavier they are, the deeper you are. The finer you are, the closer you are to the skin. Okay? So if you were going, they do use these. These can clamp, like, say they nick the artery and you see them, you can see it getting bloody or whatever. Just like a triangle. So you can clamp this without tearing a vessel. You see what I'm saying?
These are your Pennington, right?
These are your Penningtons. And so also, if you were going into a hysterectomy, you would start. You see what I'm saying? This is what you would start with, because they protect the artery without cutting through it. Okay. Cokers, this is what you would need for something heavy. And the reason you always know heavy, the teeth on the end of them. And they are pretty pointy and pretty sharp. But you can feel them. They will get, I mean, feel that tooth right there. It holds it, and it's pulled up. A lot of times you'll see them too, as they're coming out of the case, they'll grab that fascia and where they dissect it up, and it's so tough, it can hold up the skin, and they can see if they have any bleeders on the muscle and stuff. So this is for heavy holding. Now Kelly's, this is what you need in any case, any from closing to helping. This is like a big hemostat, what people don't understand. If you look at your hemostats, this is like going in on the skin, okay? It's the same thing. This is just bigger and heavier. It can dissect, like say they have a lot of scar, they can easily go bluntly open, and they can use the bovie all the way down through that till they get to where they need. At the same time, if you have a maiden vessel, you can clamp it. It's a hemostatic clamp. That's what these are. Okay? They're just bigger. This is bigger and healthier. This is small and delicate. These are simply known as Babcocks. Now, I shouldn't say this, but this is how I learned it. Babcocks are what you clamp the tube with. No more cocks can get in. It's that simple. And they're atraumatic. So what bleeds the most on a uterus is a tube, right? So it's so blunt. It looks sharp. I can close my hand in it. It does not. I mean, it is literally dull. And it just basically is for visualization. Now, Alice clamps, they're a good utility clamp. What I say by that is, it can grab, and it's a little bit sharper, but it can grab. So a lot of times on Alice clamps, they're gonna use these on the uterus, like when they do have an extension, but it's not all the way down into the uterus. So they can grab as close as they want to that artery and pull without it tearing. It's not gonna tear that paper up. It's just gonna make a mark. And this is actually what they test on the patient, like when they get an epidural. And they can clamp the skin. I mean, it's gonna make a mark, but it is not gonna cut at all. But you would think it would. You know what I mean? Like it's tough enough, but it's not. And but that's what these are used for. And the hemostats, same thing. Now, hemostats, you're grabbing vessels, and you can, if it's really, really like tender, they can grab it. They can touch the bovie with it, and it will the electric shock will go straight to it without them ever cutting it. Also, a lot of times, 2 or 3 sections in, when they pull up and they're trying to get through that peritoneum and that muscle, they've reattached it really tight. These can dissect really, really easy without ever penetrating with it. It just goes straight through it and into no bleeding. It's great. And your towel clips, they're just like to secure your cords and stuff like that for the most part. I will say a towel clip can be used in a myomectomy because a fibroid is complete mass. So they can clamp through the fibroid, pull up, and go all the way around the fibroid. That's what I've normally seen that happen. And that is the whole tray and what it's used for. Now I will say, let's look at the retractors real fast. So retractors are, as you're going in, you can kind of see how this will curve around the skin till you get through the fascia. So that's what that's doing. Is like, I want to like if this was the inside and you can pull it, exactly, and you have leverage. And Army Navy is kind of the same thing, but you're looking at the depths of what you need, depending on patient size. You know what I'm saying? The bladder blade is a cool instrument. So the bladder blade actually tucks, like this is going to be the skin. This blade right here tucks all the bladder and everything down where they only see the uterus. What that's good for, they don't hit the bladder. But you would never think that little thing would do that thing. A malleable, we usually use inside of a patient, like if their intestines or something's coming out or something we don't want to hit as they're sewing, is the only thing. And these, other than that, these are Richardson retractors. They're the same exact thing, just different sizes. So let me show you these. So if you're ever looking for a forceps, it'll help you. So let's start with the little ones. These are skin, delicate. It's the only thing you use them for. I mean, even in any other case, skin. Okay, these are called Russians. And you can look at the inside of them, how they're like little curved. They look like teeth, right? These are used on the uterus. They're not. They're to protect it. They're atraumatic, just like a clamp. Just like a clamp. You have short ones, you have long ones. On the C-sections, we use the short ones, but we do have a long one in case you have a little bit of deep one. But see how they're on the inside, like a pineapple. Exactly what they are, pineapple.
Aren't these Russians too?
No, those are Bonnies.
Bonnies.
Okay, and these are smooth. See how they're
like the coker, kind of like.
Except it doesn't have a tooth.
Yeah.
It doesn't have a tooth. So on the smooth, what they're using these for is like when they're using these nets on the uterus to pick up, to cut, to make that bladder flat. So smooth, you don't want anything.
To nick the bladder.
That's right. These are pickups with teeth or rat tooth. So as you're going in, they're wanting to pick up the tissue, cut up underneath it. Dr. Hamady would use these, the rat tooth, and she would cut either side of the fascia, okay? And you can also use it coming out like in the subacute area because you're grabbing, and you can grab that needle. Okay, saying that, these are pretty much in the same categories as these. However, these are heavier. These are called Bonnies, okay? They have the pineapples on the side, but they have the big tooth, almost like a double tooth at the end, okay? And this is for that fascia, where they can pull it, because when they're going, you can get what you call starbus, and that's like a little fat scarred, but the fascia is up underneath that. So their ticket to this with these is when they pull that fascia up, they can actually pull it and you can see that muscle. Like they know, no doubt, this is fascia and we're not gonna herniate it. And that's the main thing in that. Other than that, that is all of the instruments.